Okay, then we'll move on to the health insurance piece so that you guys can get out and do whatever you'd like to do today. I'm going to talk about the health insurance that we have through the conference. Our health insurance plan is called HealthFlex, and it's through Blue Cross Blue Shield of Illinois is the actual insurance vendor. It is for full-time clergy appointed to a church, charge, or conference connection, and you are required to be on the plan if you're full-time. Also eligible for coverage are spouses and children up to the age of 26 and adult dependents of the full-time appointed clergy. And we have two different plans this year, two different options. There's a gold plan and a silver plan. I'm going to talk about the gold plan first. It's called CDHP 2000, and the CDHP stands for Consumer Driven Health Plan. There are no copays with this. It's strictly a percentage based after your deductible, and this is considered the gold plan. The figures that I give you are for in-network providers. The office visit, ER visit, urgent care is 20% after the deductible. The annual deductible is $2,000 per person, $4,000 for a two-party or family coverage. The annual out-of-pocket max is $6,000 per person or $12,000 per two-party or family coverage. And then the maximum out-of-pocket limits include medical, the behavioral health, and the pharmacy benefits. Also, Westpath will set up an HRA, it's a health reimbursement account, and they will put that money on a debit card. The debit card is called WageWorks, and they will put $1,000 on there for a single participant, and they will put $2,000 on the card for two-party or family coverage. And that money can be used to offset your deductible. It really depends on how you spend that HRA money. You can spend it not just for the deductibles, you can spend it also for dental coverage or for vision coverage. And then that balance will roll over to the next year. It's not a use it or lose it at this point. So you will still have it even if you don't use it all in that, in that year. And then the out-of-pocket network, you need to double the deductible dollar amount. And the other plan that we have is the CDHP C3000. And as I said, it stands for Consumer Driven Health Plan. And this one is considered the silver plan. And again, with this plan, there are no copays. Also, by having the silver plan as a choice for our participants, this gives participants more choice in what health benefits best meet their specific needs. Some people don't need as much health coverage, and so this one might be a better plan for them. In 2019, our Board of Pensions would like to offer 6 HealthFlex plans that will include the 2 plans that we have right now, plus 4 additional plans. And also, there'll be dental coverage and the full vision coverage as well. And this will be called Westpath's HealthFlex Exchange. This will be approved at annual conference next week. And this particular plan, the silver plan, will be the default plan. The annual deductible for the silver plan is $3,000 for single coverage and $6,000 for the two-party and family coverage. And then the out-of-pocket max for this one is $6,500 for single coverage or $13,000 for two-party and family. The coinsurance is 50% after your deductible is met. And then out of network, the co-insurance after deductible met is 70%. And then again, the out-of-pocket max, if you go out of network, is going to be doubled. And then as far as the HRA on the WageWorks card, the dollar amount that's put on there for this particular plan is $250 for the single coverage and $500 for the two-party or family coverage. And on this plan also, the HRA balance is rolled over to the next year. And then some of the benefits that go with the health insurance. Wellness exams are the same for both plans, and they're covered at 100% as long as they are coded as such. And that can be done at any time during a year. It does not have to be 12 months in between each physical. I try to make sure that I tell everybody in the clinic, the front desk, the nurses, and the billing office that I'm coming in for a wellness exam, so that they know that that's specifically why I'm coming in, so it does get coded as a wellness exam. Both plans also include mental health, prescription, and vision. And all the information that I'm giving you is for in-network providers. The UBH, the United Behavioral Health, is our mental health plan, and that requires pre-authorization prior to being seen for inpatient services. We also have an employee assistance program under that, and that also requires pre-authorization. And you just give them a call and tell them that you'd like to participate in the employee assistance program, and you will have the first 8 visits free and paid at 100%. After that, there is your deductible, and then the percentage copay of 20% or 50%, depending on which plan you are selecting, for the outpatient and the inpatient services, and whether you are in network. The prescription plan, it is through Optum Rx. If you're taking routine maintenance medication, such as for diabetes, thyroid problems, heart medication, you will need to order through Optum Rx, which is a mail order service, or if you have access to a Walgreens, you can get them through Walgreens. And they do that for 3 months at a time. If you're just getting a prescription, you go to a doctor, you have a sore throat and maybe strep throat and need an antibiotic or something like that, you can get that at any local pharmacy. That is not considered a maintenance drug, so you can get that anywhere you'd like. If the doctor says, well, it looks to me like maybe you have a thyroid problem and we want to try you out on a medication, you can get your first dose, your first prescription, I should say, 30 days at a local pharmacy, and it'll get covered. You just can't have more than 3 of that particular prescription done other than at any pharmacy. It has to be done through Optum Rx or through Walgreens, as I mentioned. Otherwise, you will end up having to pay the full amount. The retail pharmacies will only be 30 days, as I mentioned, and Optum Rx will be 90 days. A generic drug at a pharmacy is right around $15 for 1 month, and Optum Rx and Walgreens is right around $35 for 3 months. Then the preferred brand name and the non-preferred brand name drug are a percentage copay, anywhere from 20 to 30%, and the dollar amounts range from $25 to a maximum of $120 that you would owe for that prescription. Sometimes there are specialty drugs that you may need that your doctor wants to put you on. In that case, you do need to call Optum Rx, and I believe that your doctor needs to write a letter of why you can't take the generic for that. and send that in so that they can do an override to let you get that prescription at that maximum amount of $120 rather than having to pay for possibly $600, $200, whatever the case may be on the particular drug. So you want to make sure that you, if it is a specialty drug, if the drug that he or she wants to give you has a generic drug that you can't take, that you make sure that you visit with OptumRx and your doctor so that you can get that override put on that prescription for you. And then the vision that we have is through VSP, and that's a $20 copay for an exam, and that one is once every 12 months. You do have to wait 12 months in order to have a vision exam again. And there are discounts on lenses, frames, and contacts. If you see a non-VSP provider, then the exam could cost you as much as $45, and there are no discounts on any of the lenses or frames or contacts. And you also need to send in a reimbursement form to get reimbursed for that cost that you had to pay to go see a non-VSP provider. I know Jeff mentioned a little bit earlier about medical reimbursement. Another name that you've probably heard is flexible spending. Flexible spending is the umbrella name for it, and then it actually covers the medical reimbursement and the dependent care. So in the dependent care, it is pre-tax dollars that you're eligible for out-of-pocket expenses such as deductibles, copays, glasses, and even dental work. As Jeff mentioned earlier, you can save approximately $800 in taxable income by doing this. One of the things there is certain restrictions on their use, and it is subject to IRS use it or lose it rules. So you want to start thinking about what you will have for out-of-pocket medical and dental expense and vision expenses for you and your family, if applicable, that might occur during the year. And then during the first year that you're enrolled in health insurance, it will start 30 days after your official appointment date. So typically, most of you, I believe, are starting July 1st, so that would mean it would start August 1st. So you want to look, if you plan on making that election for this year, you want to look at what you will start accumulating for out-of-pocket expenses starting August 1st through December 31st. And this first year, you can actually put that election amount on your enrollment form, and then they will be able to make that election for you. After the first year, the only time that you can do that is if there's a life event change, such as you have another child that you need daycare for. That would be under the dependent care for medical reimbursement. I'd have to think about that one. I'm not positive which that will, when you could do that for a life event change, but otherwise you can only do that in November during open enrollment or annual election. It's got a couple of names for it. And then you must go online to do that. And I send out reminders before the event period, what I call an event period, which is the open enrollment annual election time. I will send out reminders and explain to you how to go online to make those elections. And so if for some reason you can't get online, you're away from your computer's locked up for some reason, you can give me a call, or you can give the Westpath Health team a call and ask them to help you make that election. And then there's the salary reduction agreement. You want to fill that salary reduction agreement out, and keep that at your church, because your church will need that. Your treasurer will need that for their records. The max amount that you can elect in a year for 2018 is $2,600. There are no grace periods into the next year. The max that you can roll over is $500. So if you're going to make an election, you also want to make sure you keep track of how much you're spending and how much how much you have left in your account, because at the end of the year, the max that will get rolled over is $500, and you don't want to lose that extra that's going to be taken out of your salary by not being able to use the amount that you wanted, that you intended to elect. On Wednesday, I'm going to walk you through some screenshots on how to log into WestPath and into HealthFlex WebMD and other HealthFlex partners, so that you can see exactly more in detail of what I'm talking about when you need to log in and find the different vendors and make your elections and that sort of thing. And then the dependent care, and that also is pre-tax dollars for eligible dependent care, such as summer daycare, summer day camp, babysitting services while you're working. Those are just some of the things that you can use that they're eligible for. As Jeff mentioned, that also, if you have dependent children and want to use it, that also helps you with taxable income at the end of the year. And this too will be 30 days after. This is the same type of rules as the MRA. The difference between the two is the MRA, that money will be there on the day that you are eligible for it. With dependent care, you actually have to accrue it, build up the funds in the account before you're able to be reimbursed for it. The maximum amount that you can elect for dependent care is $5,000. There is no grace period, and you do not get to roll any of this part over.
I don't know if I could add this in there, Leanna, but one of the things that we did is I knew I would just have summer daycare. So all my receipts I submitted to be reimbursed in the summer, and then even though it was over how much I had accrued, as Leanna said, it kept paying that out until I had all the money withheld from my paycheck. So even if you do submit receipts greater than what you've accrued, they'll pay it out as you accrue then.
Yeah. So. Okay. Yep. Very good. Thank you. Does anybody have any questions? Okay.
Leanna?
Yes.
I'm assuming the dependent care account is for full-time or at least three-quarter time employment?
All of the insurance, this last section that I've been talking about is for full-time only, correct?
Oh, yeah. Thank you.
You're welcome. Any other questions? You'll be happy to know I just have a couple more things to talk about. And really, I'm just going to kind of go over the enrollment forms real briefly, just to kind of let you know. On the actual enrollment form, the top half is all you need to fill in. Just in the pertinent information, your participant information, such as your basic address, name, address, social security number, birth date, I believe, is in that section, spouse, if it's applicable, just the basic information for you is all you need to fill in. You don't need to worry about your church ID number, what conference it is. I can fill in that part, that's fine. And then under part 2, just the effective date is going to be whatever your start date is, July 1st, August 1st, whichever it is that you're starting full-time. And then you are considered a new hire. And then under part 3, You do want to list yourself as well as any dependents. And under Part 4, you want to check either the CDHP 2000 or the CDHP 3000 plan. Those are the two options that I talked about. Those are the only two options. There's more listed there, but you will only need to, you can only elect either the 2000 or 3000. And then the vision exam core is the one. We do not have dental this year, so you don't need to fill in any of that. And then the medical reimbursement, if you want anything for the remainder of the year, like I said, if you start July, it would be August through December. If you start August, it would be September through December. And so fill in that if you want. If you have any dependent care, it would be the same thing. Part 5, 6, and 7 does not apply to new active clergy, so you don't need to worry about that. Part 8, you want to sign that. Then Part 9, that's where I sign it. Part 10 is only if you have a different mailing address for whatever reason, you have a different one than you want them to have just to receive pertinent information. You can put a different address there. And then Part 11 is only if you have more dependents than you can fit in Part 3. And that is basically all I have. The only other thing I was going to say is I mentioned a little bit that on Wednesday when we're with you again, seeing you in person, I have just a few more slides that I will show you, just kind of walk you through how to get on, log into Westpath, and a couple other benefits that are available and requirements that are available with the insurance. But I decided we'll just kind of break that up a little bit, and so that you can get out with your day and your weekend. If you have any questions, please let me know. If you think of them later today, write them down. You can email me, or you can see me at annual conference, call me, whatever works for you. I'm here for you guys.